on the internet, and I figured I'd call him because it was quite interesting. And what he was complaining about was Medicaid itself. He does accept Medicaid patients, which a lot of doctors won't do, but he found that the routine for getting approval to do procedures on patients took too long, to the extent where sometimes the patient would have gone blind before they got approval to do the care. So he set up his own foundation to take care of these patients, so he didn't have to jump through the hoops to get approval. I'm sure that he bills Medicaid after it's all over, and sometimes it's denied and sometimes it isn't, but he takes care of his patients through his own foundation, which he set up on privately raised money. So I think that's very admirable of him, but it also points out that, you know, the government has to fix part of their health care too before they go trying to attack the private sector. I think, you know, both sectors need to have themselves fixed. If you go into what Dr. Barry Johnson said on television last week, he was talking about fraud. He's a physician who set up a committee to investigate fraud across the board, and this has to do with also Medicare, Medicaid, and private insurance, and what doctors do to manipulate the coding system so they can make more money. To an extent, I'm not justifying what they're doing, but they keep getting their fees reduced, so they manipulate the coding system. By that I mean, you see somebody and it gets a certain code. You can actually, by putting certain information which you may or may not obtain, increase the code level so you can make more money. So doctors are playing the game with the insurance companies, and I think insurance companies realize they're doing this. Sometimes they get caught and sometimes they don't. But that's wasted money, and if, you know, we could just be honest about the whole thing, everyone would be reimbursed properly, and we wouldn't have this problem. Dr. Barry Johnson talked about Medicare and Medicaid fraud, which actually runs into the billions every year. And basically what he was saying, which doesn't make much sense to me, is that Medicaid, the government, pays claims before they actually investigate whether it's a legitimate claim. So after they look at the claims after they've been paid, they say, oh, well, this doesn't look right. And then they investigate it, and of course a lot of this abuse is by crime syndicates and various people who
really?
aren't, that's what he says.
By crime syndicates?
According to Dr. Johnson, who set up this foundation to investigate fraud. And he investigates fraud by physicians and by organizations, and all through, all through Medicare and Medicaid.
The crime syndicates?
Apparently so, according to him. And so what happens is they pay the claims when they come in, and then they look at them afterwards and say, well, this doesn't look right. So when they start to investigate them, they go after these people, and of course they catch a lot of people, and there's a hospital, doctor, or whatever, but a lot of times they go after the crime syndicates. They've disappeared. They can't find them.
Yeah. So
it's money lost. And he claims it's in the billions, anywhere from 60 to 200 billion a year that is wasted. And Medicare, Medicaid in the state of New York, for example, where we live, he claims was 30% fraud last year.
Really?
Yes.
What was that thing you said we need to fix it before we...
Well, one of the principles in our health care reform was Senator Max Baucus from Montana, and he came back with the Baucus plan, which was pretty broad. He wanted to keep the private sector involved, the private insurance companies involved, but he said we need to fix it before we finance it. That was his term. And I think we need to fix it before we finance it. To just throw a lot of money at the system without really looking at the issues. And I think, again, go to our moneydrivenmedicine.org, and you will see when you can view our documentary, and you will find out what these issues are and what needs to be corrected, and it's not going to be corrected overnight. And so let's work on fixing it before we finance it. Let's work on fixing it both from the government side and from the private side. All the principals need to sit down together and work out the problems. Say, okay, I'm responsible for this, you're responsible for that, and work together to solve it. Without the private sector, and even the government sector, having lobbyists there. Let's sit down without the lobbyists and work this out. Otherwise, we're being unduly influenced by outside pressures. We know what the problems are. Let's not protect our interests. Let's take care of what we're doing wrong. Let's clean up the abuse, the wasted money, and go forward with this. Let's keep working on it. Don't let it go. Don't walk away from it like we've done with every previous administration. But let's not rush into this and spend a lot of money without even knowing where it's coming from.
You have spent has that been pretty nice to do?
Hard a lot of times. I had to do a lot of things with the children when he wasn't there, but he was always around for the important events. And for some reason we were able, because he was an emergency physician and could make his own time schedule, we got to do good vacations of camping every year. And later on in life we did a lot of exciting trips, including climbing Mount Everest and setting up treks in Nepal and things of that sort. So I got to answer the telephone, and I couldn't say the doctor wasn't in. I just could say, how can I help you, and then refer it to him. So.
Well, you didn't mention the 15 years in primary care where I couldn't handle my schedule.
Yeah.
Oh, yeah, that's true. 15 years.
15 years in private practice meant I delivered babies. This was in the days of the old family practitioner, which doesn't exist very much anymore except in rural America. And these doctors are still needed. But I delivered over 1,000 babies. I was the high school physician where I went to high school. I took care of my high school teachers, believe it or not. And I might say that one of those teachers was a tremendous influence on my life. My biology teacher, Dolores Congedo, I think she was probably the biggest influence on my life as far as going into medicine.
In what way?
She was an incredible lady. I mean, she was 150% for her students. She was a very dynamic lady, very opinionated, very strong-willed. But it was just the way she taught, the way I loved biology, and I really think that through her classes and her teaching, I was steered into medicine. I think I had an inkling I would do that before. I could tell you a funny story that when I was 10 years old, if you want to hear that, when I was working on a farm. Well, I mean, you know, all the scientific courses, particularly biology. I think that's what, and particularly, you know, my biology teacher.
And Isabel, you play the organ in the church, don't you?
Yes, I do.
Yep.
I play for a small Episcopal church across the street from us in Bolton Landing, New York. And I volunteer my time and pick out the hymns, and I really love it. It's a very nice group of people.
And it was your grandfather Folsom who was a Presbyterian minister?
My grandfather Folsom was a Presbyterian minister, that's right, and I think his father was also
Well,
a
really?
Presbyterian
Yeah.
minister,
Right.
yes.
Well, Walt, we haven't got your career. Where did you go to undergraduate school?
Well, I actually got admitted to Bucknell University. I met Isabel there the first week, and we dated the whole time. We got married a week after we graduated. So that's where I did my pre-medical.
And what was that, biology and stuff?
Well, biology, chemistry, physics, you know, various courses in that respect. And
What did you take, Isabel?
I was destined to be a teacher, even though I didn't think I wanted to be, but since everyone in my family was doing that kind of thing, I majored in Latin and mathematics, and had to take some education in order to teach.
Oh, you have to be very smart to major in those things.
Well, they weren't controversial. They were
Yeah.
subjects that were positive, and there they were.
And from Bucknell, where did you go, Walter?
well, I had a little diversion into the U.S. Navy for 2 years. I got nervous during the Korean War, and ended up going into a Navy program where I would be commissioned. And I wasn't really eligible for the program, so I don't really know how I got into it, but I did my 2 years of training, which was after my sophomore and junior year in college, and then I got accepted to medical school, so I asked the Navy for a deferment because I said, if you let me go to medical school, I will go back in the Navy and I will serve the Navy as a physician for as long as you want me.
Oh, wow.
And so basically I ended up going down to the Pentagon to make this request, and I talked to a guy in the back archives of the Pentagon, and he said, well, you've done all your training. You know, you have to accept your commission and go on active duty. And I said, well, one of the requirements is I have to have my degree. Suppose I drop a course and I don't get my degree. He says, how would you like to be a seaman recruit? And I said, I think I'll accept my commission. So I was a gunnery officer.
You were?
Right, and then I reapplied to med school in my second year, got accepted at Jefferson.
After you were through with the Navy?
Well, while I was still in the Navy, I reapplied to med school and got. I had originally been accepted at New York University, and I was waiting to be reaccepted, and I got nervous because I hadn't heard from them, so I reapplied to Jefferson, and I heard from them within 2 weeks. Never went for an interview or anything, but I got accepted at Jefferson, so I went to Jefferson Medical College in Philadelphia.
Oh, you did?
Yep.
Do you know what the football cheer is for the medical school? What the cheerleaders, their cheer is? Hypodermic, hypodermic. You know what that means? Stick it to them, stick it to them.
I got you. Of course, we didn't play football. We played basketball.
So you got out of Jefferson?
And did a 1 year rotating internship. This was...
That meant you went around in circles?
Well, we did a little bit of everything. We had 4 interns when we should have had 12.
Wow.
So we, every other night, we covered the emergency room, 2 of us. And we also covered our services, which we rotated through. And I took the additional, each person got 1 month of obstetrics. Since there were 4 of us, there were 8 months that weren't being covered. So I said, I'll take those. So during the course of my internship, and people aren't going to believe this, but I had hands-on delivery, actual delivery of 500 plus babies in my internship. And in the 9th month of my
number, Isabel.
The 9th month of my internship, we were doing a C-section, and the OB guy handed me the knife and says, Walter, you've seen enough of these. I think you can do it. I'll take care of the baby. Now, that would not happen today, but when I went into my private practice, I think I was pretty well on to delivering babies. So I had 1,000 deliveries during my family medicine career.
Yeah, how many C-sections did you have after that?
None.
None?
That was my one and only C-section. But people wouldn't believe that today because I think you have to be an advanced resident before you can do a C-section.
Oh, I see. And so after the internship, what did you do?
Well, I went into private practice.
And that was where?
In Susquehanna, New Jersey, Morris County.
Morris County, what's that near? Big town?
Morristown.
Morristown, okay.
But I actually became an attending physician on the staff of the hospital where I was born.
Wait a second. Now, how'd that happen from Morristown?
Well, I was born in Dover General, and so I worked out at Dover General.
I see. And so you went and took that. Did you like that change, Isabel? From Morristown over to Dover?
Oh, no, we weren't in...
We never actually worked
No, I just used Morristown to give you an idea where...
Yeah, we moved around a couple places, but we pretty much stayed the same, for 25 years in the area.
In
the Morris
Dover,
County, Dover area, yeah.
And that was the area where you were brought up?
And I was brought up in Essex County, Morris City, Bloomfield, where we did everything in Newark, New Jersey. Yeah.
Yeah. And so then how long did you practice there? In Dover?
Well, I did primary care for 15 years and then got disenchanted with the group for what I told you.
With the sort of thing that you've been exposing to us, you mean?
Yes. You know, the group got bigger and bigger and became dominated by, I call them carpetbaggers. They came from other towns. They didn't have any allegiance to our town, even though they were taking their incomes out of there. I was the only Rotarian in our group. I was also the school physician. I also set up a hotline for drug abusers. I also did free clinics for 2 of the surrounding towns. And, you know, we took care of everybody came in the door. And then finally we were told we couldn't see people for free. And I said, you know, I think we're out of here.
No, really? And you actually would see people for free?
Absolutely.
Whether you could pay for it or not, you help them.
If somebody came in and said, gee, Doc, you know, I don't know whether I can afford your care, I said, why not? And they would explain. I said, don't worry about it. We'll take care of it.
And then sometimes we got cabbages and tomatoes. And
Yes, right.
Somebody came down and refinished our cellar or something
Right.
like that.
Really?
Yeah, we used the barter system. I mean, I had people paint my house, would fix my roof, do this and that. Sometimes I paid them more money than what they would have owed me, but it didn't make any difference, and I never had any complaints from my patients. And we just took care of everybody. We gave senior citizens discounts before Medicare even existed.
Oh, that's wonderful. I love it.
And you had no charge for clergy or nurses or?
Yeah, I mean, right. Took care of my nurses. When I started working in the emergency room, my nurses used to call me at home if their kids came in with lacerations for me to come in and fix them rather than calling the plastic surgeon. Unless the plastic surgeon was a good guy, and a lot of times the plastic surgeon, they didn't like the plastic surgeon on call, so they'd call me. But great bunch of nurses too.
What year was that you said, I'm through with this?
I left in 74, went to the emergency room, and I eventually became the director of the department.
Is this Dover General?
Dover General,
Mm-hmm.
right.
And then what happened, Walt? Walt, where did you go from Dover, New Jersey General?
Well, before we left Dover, we got involved in a hospital merger, and I don't think most of the medical staff was very happy about that. We probably would have been better off going with another hospital than the one we went with, but they basically moved everything out of our hospital down to their hospital, and we barely functioned as just an emergency room that was feeding them, and all the growth was going westward. It took 4 administrations for them to straighten that out, and they finally turned it around. This was after I left. And we became a functioning hospital again.
Big disappointment to you, wasn't it?
A big disappointment. And,
right, Isabel? Big disappointment.
Yeah, it was. Yes, certainly was.
Because you spend so much of your life building it up.
Right.
That's right, yeah.
So after I retired, which was 1965?
Was it? Yes?
At age 65, you said.
At age 65, I'm sorry. 96. And I started working on cruise boats. And we retired up to Lake George, and I actually got on the staff at Glens Falls Hospital and worked in their emergency room per diem. And we also did a couple of stints in Nepal during volunteer medicine in a remote clinic, and twice in Nepal. I also did
Nepal, over where Mount Everest is.
Yes,
Oh, yeah.
yes. Mm-hmm.
What'd you think of that, Liz? I mean, Isabel.
Well, I enjoyed working there. It was a little bit of a hardship, but we spent 3 months in the mountains in the Himalayas taking care of. Well, our job was to take care of the trekkers, but the foreign people. But most of our patients were local people.
You helped them, yeah.
Who paid a few pennies or whatever they had, or didn't pay at all. But
Right.
It was very interesting. We had a relationship with the community and.
Well, you know, I think most people go into medicine because they want to help people. And I think that's really why I went into medicine, because you want to help people and you want to give back. And maybe that's why I married my wife, because she was that way. Her whole life as a young person in high school, she was always working with the Girl Scouts in the community, doing stuff with her church, and she's continued to do that. And I think both of us have worked very hard giving back to our communities.
Yeah, thank you for that. And that's still true today? People are still coming out doing that today?
Absolutely, absolutely. But as I said before, I think the doctors are frustrated with the system, and there's been a definite breakdown of the doctor-patient relationship because of the system. You know, doctors don't have the time to sit with their patients. Patients feel that. Doctors feel that. You know, I think they're frustrated about that. They're frustrated with the reimbursement system. They're frustrated with a lot of things. And, you know, we've got to fix that. We've got to get back to the old-time relationship.
Well, that'd be nice, yeah.
Where a doctor can sit with his patients. Not that they're going to do house calls again, but, you know, by doing house calls, I got to know my families. I knew where they lived. I knew if they were poor, if they were well off, if they weren't. And that's how I treated them when they came to the office, because I knew these people. They weren't just a number or someone coming to the office for an appointment. I knew them.
Those were the days.
Those were the days. we've got to get back to that relationship between the doctor and the patient somehow.
Yeah. Oh, that's so, I love to hear you say that. Isabel, did you climb Mount Everest?
Well, coming out of our treks to Nepal that we'd done for a number of years was his interest in climbing Mount Everest. He always wants to go further and higher and longer, so we had, he's been on 3 expeditions to Everest, and 2 of which I was along with him, not as a climber. But that took a lot of years out of our life of activity and slideshows, and preparing was very interesting.
You climbed, though. You got to the top.
No, I got to 27,000 feet, which
That's pretty good, isn't it?
well, at that time, it was the highest anyone my age had gotten. I was about 60 years old. But since then, there have been 70-year-olds that have summited. I'd love to go back and do it, but nobody else wants me to go back and do it.
No. Well, you said there was a point that you wanted to mention. You just thought of it. Can you go ahead and mention that?
Well, that was the issue about getting back to the old days and giving back. That was what I was talking about. And I wanted to acknowledge my wife for what she's done.
No, thank you.
Giving back to humanity also.
Appreciate that.
Because more people should be doing that. And I think across the board, if all the doctors got together and gave equal time back to patients, we'd have less of a problem also.
Well, one doesn't feel right if you're constantly taking from everybody else or trespassing on their property unless you're going to give back something in life.
Right, right. So that's where we're at.
And you finished that point, did you?
Yes, we did.
You know any good doctor's jokes?
I'll bet you do, Glendora.
Yeah, I'm sure you do some.
Have you got any good ones?
Oh, I can't remember any of them, but no, you better tell yours.
You sure?
Well, I could tell you one that was.
I said to the patient, "There's nothing I can do for your disease. It's hereditary." And the patient said, "Send the bill to my doctor, for my father."
Oh, that's a good one.
Yeah, that's a good one. That's a good one.
And let's see, any other good doctor's jokes? Isabel, what was it like to you to see your son become a doctor after living your life with your husband, a doctor?
Well, I am absolutely amazed at what he does because he's a spine surgeon, and I just can't imagine the responsibility that he takes when he operates on someone's spine and takes care of them. I'm very proud of him. He takes that even further. He goes to India and does charity surgery there for every year.
How did he happen to choose it? Were you feel that you were motivated him?
Well, yeah, I think I might have been a motivation for him to go into medicine. He went to Bucknell, same as I did. He was pre-med there.
He was in the Navy.
He was in the Navy also. He went to the same medical school. But the interesting story about it, it was so competitive pre-med wise when he was in school, and he's the kind of kid that would help everybody and go out of his way.
Oh, he got that from you.
And what happened to him was that every time he wanted help, they were too busy. So he called me up. He called me up and he said, "Dad," he says, "I'm not sure I want to be a doctor." And I said, well, "Jeffrey, let's get one thing clear. You don't have to be a doctor because I'm a doctor or you think I want you to be a doctor. You have to be a doctor because you want to be a doctor." I said, "Why don't you go out to our condominium in Utah for a week and ski and then think that over and come back?" And I always kid him that he really wanted a free ski trip. But he came back from that trip, he called me up and he says, "Dad," he says, "I'm going to tell you something." I'm getting emotional about it.
Yeah, it is.
He says, "I really want to be a doctor." And I said, well, I'm glad. And he says, "I'll tell you why I want to be a doctor."
Big moment.
He says, "I want to be a doctor just like you."
Oh.
And that's what he said.
Yeah.
And
Boy,
he's
how
a
old
kind.
was he?
He was in
When he
the
said
second
that
year
to
of
you?
college.
How old was he when he said
Probably
20.
19, 18. Yeah.
that? Wasn't that nice, Isabel?
Yes,
Yeah.
that was very, very nice.
But he's the kind of doctor that I respect because he talks prevention to his patients. He will sit, and he doesn't get reimbursed for it. That's the other thing. Even the specialists who will sit and talk prevention don't get reimbursed for talking to their patients about prevention. And he will spend the time to get you to stop smoking if you have disc disease, because it is a risk. He will not operate on you unless you have gone through every possible rehabilitation thing there is, and if you don't get well, then you get surgery. It's the last resort. Yeah. And he doesn't operate for money. That's what I'm saying. I've seen doctors who operate for money. And
Negative thought, but it just bothers me so widespread, the tentacles of this money-driven medicine. You bring in organized crime, you bring in people changing the codes, you bring in, and that's really very disheartening.
I mean, these are the things that, we definitely need to look into, straighten out. It's handled in the documentary. The experts talk about it, and they talk about what needs to be done to cut the waste, to cut the expense. But everyone has to get into the act. It can't be unilateral. It has to be the government, it has to be the private sector, and it has to be the patient.
Yes. And the both of you are in favor of holistic if it's going to heal, right?
Oh, yeah.
Absolutely. I think the holistic aspect, the alternatives to medicine, they're out there. They do work. You don't hear about it only through the massive advertising of the holistic people, and I'm sure there are a bunch of people out there just into it purely to make money, and maybe all their things don't work. But there's a lot of good things out there that the public is unaware of. In some respects, I think it's maybe suppressed by the massive advertising by the pharmaceutical industry. And of course, they don't want you to take a simple thing like cinnamon for your cholesterol, which would lower it. They want you to take a statin drug.
What's that?
Well, these are these anti-cholesterol drugs that lower your cholesterol.
Oh, okay. Guess how I lowered my cholesterol? I stopped eating meat.
So you became a vegan.
There you go.
Yeah, I stopped eating all animal products.
Well, there are many different ways that you can lower your cholesterol, and all it takes is a doctor to sit down with you, talk about nutrition, exercise, weight reduction, other alternatives that may work.
Well,
and let's try that first before we put you on a drug.
You become a motivator that way. You become somebody who's interested in the person, and they want to please you. And
right.
So they will do it for you. I think that's great. Now, the two of you look very good. You must have good diets.
Well, it's part of our lives to try to exercise. He does it to excess. I do a minimal amount, but every day I try to do something, whether it's walk, swim, ride bike, whatever.
And you must watch your eating, too.
Yes, I am watching my eating now. I got a little overweight. But,
yeah, you look good.
I'm working on it.
Well, I didn't always look this good. When I was my third year in practice, I weighed 215 pounds.
Ooh.
I was smoking.
Ooh.
And here I am talking to patients about changing their lifestyle and reducing their risk, and I think I'm being a hypocrite.
Yeah.
So I went on a diet, stopped smoking, and started running simultaneously. And without bragging, I sort of became a role model in the community as a runner.
Oh, good.
But it helped me motivate my patients.
Yeah, sure.
And
yeah,
I got a lot of people. In fact, some of my patients became runners with me.
Oh, really? That's lovely.
And
McConnell, what is that? Scotch, Irish?
Scotch Irish.
Scotch Irish?
Yeah.
Those Irish that got sent to, the Scots that got sent to Ireland, yes.
The Scots that got sent to Ireland?
Yeah, they were Protestants, Northern Irish.
We were troublemakers, like my teachers told me. You know, Walter, you're always in trouble in my class.
Part of the
But they came to me as a doctor when I got out.
Part of the McDonald clan.
And of course, I know Folsom. Folsom Scots, Irish, and English, and that's why we can't get along with ourselves.
Oh, is that it?
Yeah, that's right. Yeah, the Folsoms are English.
I guess thought they said we were Vikings to begin with.
Well, they did. He did say that.
He did say that.
And that's right.
I suppose almost everybody did.
Well, he
British
pointed,
Isles was Vikings at some time.
Yeah, he pointed out that the British Isles were invaded by everybody.
Yeah, yeah.
And so that's why we... Well, there are lots of things I wanted to talk about, but as usual, I cannot read my writing. So I'm going to say, if there's anything else that you folks want to say before we say goodbye, anything you want to say? It's easier than coming down again from...
Well,
Well, thank you. We've enjoyed our visit. And
absolutely, and
very special, unique woman, and
absolutely.
I'm sure Walter's enjoyed sharing his health care because he's very much into it now, and he's talking about it a lot because he has to talk to a lot of people. So.
Well, I certainly enjoy being able to have access to getting the word out about what's wrong and how we can work together to correct it. Let's hope we get together and work.
I can feel you looking out for us. He's looking out for us. And I can feel him looking out for the people in his own profession. And I can see him looking out for the country. I felt all of that, and I want to thank you for it.
Well, thank you.
You're welcome.
And I was glad that on a chat with Glendora, you had an opportunity to say everything you wanted.
Well, I hope I got it out there, and I hope people will go to our documentary and see what it's all about.
Yeah.
Be informed, and not only that, they can go to the documentary, they can fill out a survey, and that survey results will be fed into Washington.
Oh, good. Yeah.
You mean the website?
Yes, they can go to the website.
You fill
There
out.
will be a survey on there, and so we're saying get educated, be informed, and then participate and be heard.
Walter, what do you want the people to see on the screen? Tell me right now. You want a telephone number where they can reach you?
I guess, well, I guess the website would be the best because they can put their comments on the website.
Okay. You can call me, folks, and I'll do what Isabel used to do. I'll tell you what you want to know. And anything else, Walter? Give me the name of the money-driven medicine.
Moneydrivenmedicine.org is the website. They should be able to see clips on the website about what the documentary is about. They will be continuously updated as to where they can see it, buy DVDs, watch it on the website, whatever they need to know about it. The survey will be on there shortly. They'll be able to fill that out.
And I'll put on here MD Walter. You want a middle initial?
Well, it's Walter L. McConnell.
L.
Yes.
L stands for lassitude.
No. LaRue. I don't know where I got that from, but
Family name.
it's a family name.
Yeah.
And
That's nice. And you're an MD,
MD,
mentally deficient.
mentally deficient.
PhD, called higher and deeper.
I'm sure a lot of people would call me MD, mentally deficient.
MBA, more bad advice. You got any more?
PhD, push here, dummy. With the camera.
Yeah, right.
PhD, push here, dummy. The camera. PhD camera.
All right. And so the only address you want up there is the website, right?